This is a study that was done in Scandinavia where the endometrial thickness was plotted, and you can see that in this receiver operating curve that most cancers were over 6 millimeters, and that it had very high predictive value. Now, patients that are receiving hormone replacement are decreasing ever since the Women's Health Initiative showed a higher incidence of breast cancer associated with this therapy. But some patients still undergo some form of either estrogen supplementation or are on a SERM, which is a selective estrogen receptor modulator, and the most common one of these is tamoxifen or roloxifene. Now, one should be aware that the endometrium in patients on HRT should be about the same in thickness as patients not on HRT. And these are several studies which have shown that patients on hormone replacement have about the same thickness of the endometrium. And this is important because patients on hormone replacement will still have bleeding. In fact, it's not uncommon up to 3 months to have bleeding. Here are a few examples of patients on hormone replacement that had abnormal endometria. As you can see here, this is a 13 millimeter bilayer thickness. This patient had hyperplasia, and after D and C, you can see a very thin endometrium. This patient had bleeding, and the endometrium is slightly thickened, but also very irregular. And this is a patient with an endometrial carcinoma. This patient had endometrial carcinoma that had invaded into the inner myometrium, as shown right here. Now, it's not uncommon for patients that have bleeding, and one may find, in fact, a mass on transvaginal, and the pathology comes back negative. This is typical of patients with polyps, that the polyp indeed is missed by the endometrial biopsy papille, and the surrounding area is in fact atrophic. And here is an example where sonohysterography was very helpful in identifying an area of abnormality in the endometrium that was actually missed by initial biopsy. As you can see here, there's focal thickening of the endometrium, and the other area of the endometrium is relatively atrophic. Now, SERMs, or selective estrogen receptor modulators, are basically a class of drugs that are used to prevent osteoporosis, decreasing the possibility of fracture of bones, but they clearly do have a increased risk of deep vein thrombosis, and we have been involved with study of these medications. Just for those people that are curious, these drugs mask the receptor sites, and the most common one of these is tamoxifen. Tamoxifen is given to patients with breast cancer to decrease recurrence rates. It's also been shown, unfortunately, to be associated with increased incidence of a very specific type of hyperplasia, as well as patients that have carcinoma. And here's an example of a thin endometrium in a patient on tamoxifen. And it's not uncommon in patients on tamoxifen to see these little cystic areas in the inner myometrium, which represent reactivated foci of adenomyosis. And here's another example of these clefts associated with adenomyosis. This is an older case where a hysterosalpingogram was done showing these diverticuli associated with adenomyosis. Now, tamoxifen can also be associated with a polyp, and in this case we have cysts inside the polyp, very nicely shown on transvaginal sonography. Now, whether or not patients are actually followed on tamoxifen is a choice the clinician has to make. But this was a study which showed that there was an unfortunate high rate of perforation of the uterus when these polyps and endometrial thickening was worked up by endometrial biopsy. So basically, most patients, unless they have bleeding, will not undergo sonography. So these hypoechoic areas in the inner myometrium, there's of course a differential diagnosis, but these are most commonly associated with adenomyotic foci. Now sometimes these cystic spaces are seen within polyps, as shown in these slides. There is a drug called Evista that does not stimulate the postmenopausal endometrium, and in fact is given in patients with a history of breast cancer. We studied a drug which was called idoxafen, and I show these slides because there are subtle changes of the endometrium we can see on sonography that in fact are not found on pathology, and I wanted to just show you some examples of these. Here is a patient. These were all patients that were followed up 3 months after starting this drug with endometrial biopsy. This is a normal endometrium, and 3 months later you can see some thickening, and this was a negative endometrial biopsy, even though the findings on sonography showed some thickening. Another patient who starts out with this endometrium and ends up with some cystic changes. So my point is that sometimes the endometrial biopsy don't show changes that we see on sonography. Another patient with these little hypoechoic areas in the inner myometrium that are probably reactivated adenomyomas. And we can see that again in this patient, and we can see the little cystic areas associated with adenomyosis. And this patient underwent MR showing these adenomyotic foci in a patient. So there are many causes of false positive of endometrium that I wanted just to discuss. I'm showing you some examples of adenomyotic foci that appear as cystic areas. But histologically, cystic atrophy can be associated with thickening of the endometrium primarily because of multiple interfaces produced by the microscopic cysts. False negative, incomplete delineation, poor patient cooperation, and substandard equipment. Now, these slides were lent to me by Anna Parsons, who many years ago now looked at areas that she saw that were abnormal on transvaginal sonography and did histology in those areas. And here is what appears to be a thickened endometrium. When sampled right here, we found these cystic areas in so-called cystic atrophy of the endometrium. This echogenic focus right here represented an adenomyotic foci. So adenomyosis can give a very abnormal image in the myometrium and displace the endometrium, in fact, as you can see in this example. And in adenomyosis, the vascular supply is different from fibroids in that it's scattered, and on 3D we can see that the thickened myometrium can in fact displace the endometrium.